language that we needed for implementation, the sample policies that a hospital could literally just take and create their own. And that was our goal on our end, was okay, now that it's passed, let's use this opportunity to educate nurses about the endocannabinoid system and doctors about cannabis medicine. And that's where, you know, I wanted to bring up that there's a lot of hope here. Even with the medical community, like Ken said, Ryan's Law is starting to bridge that gap between plant medicine and traditional healthcare. And since 2018, the nurses, the National Council State Boards of Nursing, published this in the Journal of Nursing Regulation, and it's the National Nursing Guidelines for Medical Marijuana. And it's a huge book, not huge, but pretty big for something of this nature. And they took a look at all of these things that nurses needed to be aware of. And so they look at the current legislation and the scientific literature review, you know, what's out there with studies, the nursing implications, what does it mean for nurses, as well as this nursing care for patients using medical cannabis, because we've never had these guidelines before. This was new in 2018. But I'll say it was new in 2018, and we're now, you know, 4 or 5 years past that. And so it's time that nurses in healthcare facilities really start to understand that this information exists. And so we need your help too. If you're talking to nurses, say, hey, do you know about the NCSN nursing guidelines? This is part of the work that we're doing. And it's really beautiful because they put in here these recommendations, which are these 6 principles of essential knowledge that all nurses should be aware of. And the first one is that nurses should have a working knowledge of the current state of legalization and medical and recreational cannabis use in your state. Well, duh, it's different in every state, so the nurse needs to be aware of those laws. And the nurse shall have general knowledge of the principles of the medical marijuana program. Again, these are kind of like no-brainers for those of us that have been around this for a while, but we are literally saying this and hitting ears of nurses and healthcare providers for the first time. A nurse shall have a general understanding of the endocannabinoid system, cannabinoid receptors, cannabinoids, and the interactions between them. So this is all really hopeful for us as we're starting to see that the nursing community is looking into this and understanding the science behind it. Nurses shall have an understanding of cannabis pharmacology and the research associated with medical cannabis, and a nurse should be aware of the facility and agency policies regarding administration of cannabis. So this falls right in line with what we're doing with Ryan's Law. What I love about Ryan's Law that Ken didn't say, but I'll say it for him, is that he wrote this so that it would be hands-off for healthcare providers, and it's truly patient empowerment. This is a patient's right for you to have your medicine in a hospital, you know, if you're terminally ill, and be able to use it without having the pharmacy in there, without having a nurse administering it to you, or a doctor saying, oh, you can't have it, you just had it 2 hours ago, right? So this is really important, the way that Ryan's Law was written. The most important thing, though, to me, is this 6th principle of knowledge that all nurses should be aware of, and this is written in the guidelines. In addition to ethical responsibilities under the nurse's jurisdictional law, the nurse shall approach the patient without judgment. Yeah, right? This is big time regarding the patient's choice of treatment or preferences in managing pain and other distressing symptoms. And it says that awareness of our own beliefs as nurses and our